My name is Heun. I'm a consultant psychiatrist, and I would like to give some comments about Attention Deficit Hyperactivity Disorder. This is in our series Global Psychiatry Archives, Mental Health Disorders Explained. And I would like to say that ADHD usually improves in older people and gets better and better. Usually patients or children who have ADHD may more or less grow out of it. However, it's more and more common that ADHD is detected in older people who have this disease for longer, and sometimes they have felt like being a bit abnormal or maybe a bit overactivated compared to others since their childhood. Usually in age, the overactivity lessens. However, poor concentration, impulsivity, and risk-taking can worsen. Usually, people have problems at work, education, family, and social interaction by being very impulsive or not concentrating or being easily distracted in conversations. And usually, people who are adults who present in symptoms with ADHD in primary care or then usually later in psychiatric services, they should be referred to a specialist, and they can have specialist interviews. Sadly, most of these interviews are also available on the internet, and people more or less tick the boxes very easily without being totally clear what they go into. The problem is that the medication, which is more or less the same as the ones in children, on the long term can cause strokes, can cause hypertension, can cause sleep problems and else. Hence, it's very important to start with low dosage. Sadly, none of the medications is formally approved in the NHS for people who have ADHD starting or treatment starting in the post-adolescence. So drug treatment, however, should be a part of adult ADHD treatment, and usually one also has to continue. Children who have been diagnosed with ADHD and have been stopped, they very often want to restart. So usually when you start with the medication, one can normally start with methylphenidate, dexamphetamine, lisdexamphetamine, and one has to find the lowest doses, which causes some symptoms, which causes no major symptoms, but treats the symptoms. Sorry for that, Anyway, so usually you start with a low dose, wait months, then see the patient again, then see whether you need to increase or whether you can stop increasing. And if, as a psychiatrist, you are happy with the medication and it can be kept, then you can refer to the GP, who usually would continue giving you the medication and will also do the yearly checkup, which includes ECG, blood pressure, and bloods in general. Thanks for your attention, and if you want to see more, please subscribe to our channel. Thanks a lot, and good evening.